All right, was one was so this. My name is Dr. Lorenzo Gonzalez. I have the privilege of being the president of CIR-SEIU, which is the largest physician union, labor union of doctors in the nation. And I have been invited here to moderate this conversation with, to me, what I like to consider visionaries. People that are really pushing the idea of what is health equity as we know it and what direction it will be moving forward. Digital health is something that in my union work and my union labor, we've seen as an ability to really change how our patients are experiencing their day-to-day interaction with the hospital that I trained in. I'm a board-certified family physician, and what I noticed was that disease doesn't just start when you go into a doctor's clinic, but it's actually a long process. My mantra is, disease is the manifestation of oppression. And therefore, in order to be able to address disease, we have to be able to hit it from all different angles and be agents of change. And with that, I was able to encounter Dr. Jhaimy Fernandez and the medical student Melissa, which she will hopefully be joining us soon, and saw folks with ideas, saw folks that said, no, just the same way cannot be the way we move forward. Through our union, we were able to start incubators, what we call quality improvement or patient care funds, where we had residents say, you know what would be a really good idea? If we text message people when their clinic visit is about to happen, right? So they don't have to just wait for 6 hours. During the COVID pandemic, I remember hearing for the first time ever prayer through an iPad. And that was haunting. But knowing that it was a form of communication, knowing that that was the way people were able to communicate with their loved ones when all doors, and I mean all doors, were closed. So this is a topic that has relevance and intersections throughout. I always start my thoughts with a quote. It's a quote from Dolores Huerta, and hopefully it sits. I couldn't tolerate seeing kids come to class hungry and eating shoes. I thought I could do more by organizing farm workers than by trying to teach their hungry children. Again, what we're doing here is trying to push those boundaries. What we're doing here is trying to figure out alternative ways. And I'm so happy to be here to bring this conversation to you all. So with that, I want to introduce Dr. Jhaimy Fernandez, who is one of the directors here from SaludConTech. I'll let her tell her amazing story so you get to know her, and then we'll follow the story from there. Okay? So with that, source.
Great. Thanks, Lorenzo. What Lorenzo didn't fail to mention in his introduction is that he was also my chief resident at Harbor-UCLA last year. So he did graduate and bestowed with me before he left that we're not only physicians, but at Harbor-UCLA, we make physician leaders. So it's okay for us to step outside of our comfort zone. And I really wanted to talk to everyone here, and especially all the pre-med students, medical students, residents that are online, to show you how we as physicians coming from a very strict, very structured education system can start learning from outside industries to help our patients. I grew up here in Los Angeles. My parents are Mexican immigrants. Somebody asked me recently, when did you decide to be a doctor? And honestly, I don't remember never not wanting to be a doctor. My grandma told me when I was really small, that's what I was going to be, and that's when I was. I am the first Latina doctor in my family. I went to UCLA for undergrad, struggled through some hard science classes that I wasn't prepared for. I did a post-bac program at Cal LA, then I went to University of Vermont for medical school. So very different than that. Oh my goodness. It was 2.5 of us. Yeah, my friend, Jose, and Megan, who was half Mexican. So let's do that. Yes. But honestly, going to Vermont was a big whiplash in many ways. Not only was it a culture shock, but in medical school, where all I did was medicine 24/7, really helped me reflect about why I wanted to be a doctor. And that's when I realized it wasn't what I was getting from that school. Like there, I was learning how to treat diabetes like a disease, but I already knew from the community that I came for that my patients needed something way different. Like my patients can't even get this insulin. Like those are problems that I need to help start designing. In medical school, I had a really great mentor who introduced me to design thinking. Has anybody here heard about design thinking? Oh, good. Yes, and many hands. So it's a practice of being very intentional with the way we design products based on feedback from the people we're designing for. So this is a very simple topic, but a lot of the times it's not used, and especially when it comes to healthcare. So in medical school, as you guys all know, that you focus 100% on just studying, getting your tests and moving forward. But for me, that was so draining. Like, that's not what medicine is for me. That's not what it was. That's not why I came. So I made a directed effort. Some counselors told me not to do it, but I did anyways, to leave Vermont after my exams and go to big cities like Boston and New York and participate in hackathons. For those of you that don't know what the hackathon is, it wasn't just coding. It was people from all different industries, whether it was software engineers. So this hackathon that I went to in Boston was about hacking the opioid epidemic. Huge in the East Coast. So many problems that we need to do. So they advertised it. So engineers came, marketers came, people from all business field came. And guess how many healthcare professionals came to that hackathon? Medical students. Yes, and I was a medical. I think it was me and one pharmacist who were able to. We were the prize physician. Everybody wanted us on their team. And I was like, okay, guys, well, I've seen more patients on my third-year med school than any of you have. So let's see what we could do. And so our project ended up winning third place. So some other people thought they knew more, but it's okay. But that experience really taught me, like, I know going into medicine as Latina, that's breaking a field, right? Going into tech as a Latina, that's breaking another field. But imagine that intersection, how powerful that could be if we're able to hone both of those skills. And that's what's really motivated me. I mean, that's why I really wanted to create this panel. I'm really excited to bring Melissa on board, to bring really a different perspective of how our next generation, millennials, Gen Z, is utilizing something that we haven't talked about on this panel yet, but social media, to be very accessible. So I'll give a little quick introduction for Melissa. So when she comes on, she could roll with it. But I actually met Melissa on Instagram. Her handle is Brown Girl White Coat. She has, I think, 50,000 followers on Instagram. And she's like a super medical influencer, following her sister pre-med path all the way to now she's a third year medical student at USC, interested in family medicine or psychiatry, very passionate about mental health. And this last summer, during the pandemic, as we said, everything was closed down, right? We always talk about the hospitals and physicians not having access to that. But then we never talk about the students. What happened to us? The first thing they told us, get out of the hospital. You're using up our PPE. Stop, don't waste it. So our opportunities to learn were cut in half in the beginning. So Melissa was very ingenious and decided I still want to help health education classes for my community in East LA, because it's not like all of a sudden they don't be it. So she went into Zoom and hosted these classes that had some really interesting results. So actually, I'll pass it on to everyone. No, I'll see you there once Melissa comes back.
Yeah, I mean, while we wait for that, if she's able to join, I feel a lot of passion in what you're saying, right? You all can feel her passion, and I want to see if you can articulate why does digital health and digital health equity, why does this matter to you? Like that specific question.
For me, being a primary care doctor is all about access. Everything is about access. In medical school, I told my dean I wanted to work for CVS because there's a CVS on every corner, and I didn't want my patients to go like too far to go see me. Or for me, after I heard about that, Melissa, after I heard about that, then I heard my thinking and I was like, oh, digital health? Wait, I could be in people's skulls? Oh, wait, that's closer. So that was my aha moment.
What was your early life? Like, tell me more about your aha moment. When was it when you said, this is the path? There's a point where there's a fork in the road, everyone's going right, you said, I'm going left. What was that for you?
The pandemic. 100%. They told me, get out of med school, you're using up my PPE, that's it. Everything I was trained for was out of the picture. I could still help. That's when I started getting into social media. And I started creating videos on TikTok and Instagram combating misinformation. And it's something easy, right? And before I was doing all these other social media things, I remember the dean at my med school being like, Jhaimy, stop wasting your time. What are you doing? And then after the pandemic, hey, Jhaimy, can you make a video for our school? And in Vermont, I think I was used to be the outsider so many times because of our culture, because our beliefs and everything that I just was used to being on trailing my own path. But I think that definitely did make me stronger. And then once COVID ended, then I was like, oh my goodness, we did so much with digital health. Like, let's continue. And and I know how much of a need it is because I've been in spaces where there aren't any medical professionals, let alone people of color, that I become so passionate in recognizing people and other Latinas and Latinos who want to go into healthcare and be at the intersection.
I think this is a good time we have more questions, but I want to go out and not wait till the end, because usually we'll wait at the end. There's not enough time. So I want to be intentional. If anybody hasn't questioned so far, if it's from the medical journey perspective, from the digital health to the health equity aspect, I think we're talking about a lot of different subjects. And hopefully there's a lot of things going through the mind and developing some questions. So I do want to just open it up if anybody has a question right now.
When you think about health misinformation and how different populations react to it or act on it or ignores, truth in some cases, and what are some things that you learned that worked well on social media as you were kind of combating a lot of the misinformation that was out there?
Let me just repeat the question for the folks. So this question is about health misinformation and how you've been able to combat that through your trajectory.
The first thing that comes to my mind is my family. During the pandemic, my dad is one of 7, so I have many uncles. My oldest uncle is a construction worker, and once COVID started, he was an essential worker. Had a typical story, kept going to work, got sick. His extended family didn't know about it for like a week afterwards. I was in Vermont, I was in my interviews, and I got a call. Hey, I had this, I think I got COVID, what should I do? Like, oh my goodness, I'm all the way here in Vermont. I was like, see a doctor. He's like, no, I'm not going to see a doctor. My neighbor took this. My neighbor went to the doctor. They didn't let me leave the hospital. They didn't let him go out. So the reason why I'm telling you the story is because getting my uncle to go to the doctor, and I'm sure many of you here have stubborn family members, and even though you're a doctor, even though you have healthcare professionals, is the hardest thing to do. It's so hard. And just having me like, okay, you want to go, okay, let's look at your oxygen. What's your saturation? Okay, now stand up. Do you feel short of breath? He's like, kind of. I was like, walk. That means you're short of breath. Okay, let's call the ED. Let's do this. So I think to answer your question, a lot of it has to be show, don't tell. Prove it to me that you're okay. And we need to be creative sometimes. And a lot of the times, even though we did this and I hung up the phone because there's a 3-hour time difference and I have to go to sleep, he still didn't know until 2 a.m. So it was too late until he had to be intubated a week later, until he died 3 weeks later. So this topic is so, so dear to my heart. And I bring this up because it is getting close to his anniversary, and I'm very keenly aware that a lot of us also have patients, family members, friends that have been touched by this disease. And there's a lot of work to be done.
there was a lot of misinformation around the vaccine. And I think people were, my mom told me some crazy stuff about aborted cells being used. I'm like, what are they talking about? I'm like, isn't it a chicken eggs? Like, I don't even know. So like somehow they found some way to connect that taboo topic in the Latino community with vaccines to make people feel bad about taking them. So has there been any like organizations that are doing really good work that we can like point our family members to as a trusted source?
You know, this brings a lot of, and I know I'm not officially out there. I just want to say that misinformation has been the hardest thing to combat as a physician in the clinic, being to your patient, being like, that's just not super. But little did I know that my words weren't enough. And realizing that there was more at play. And one of the big things that we, in the institution that I previously worked in, we did a huge effort to look at equity, diversity, and anti-racism. And when we looked at that, and we had these huge forums of participation, we wanted to hear from every sector of the hospital, every sector of the hospital-wide system. One thing ranked true, right? And where's that? The health system. The community did not trust us. That was the number one thing. So now we are the supposedly information bearers, yet our word is not what's being trusted. There's other avenues. And through, digital health, social media, there's a way to be able to put your messaging out there. The other way I noticed, you just got to partner with people that have been in the community for decades. So I always talk about the Latino Health Access down in Orange County, where they've been doing 30 years community work. That the idea of promoters, they've been doing that work. The thing that's more a better source of information is someone you know. But we have to tap into that. So pointing to one is Latino Health Access. Any other question before we move on to an official question?
How can we show the general public that science is not perfect? The science is always changing. We're always learning. And I guess a source of misinformation for COVID was like, the incubation time is this much. But then scientists figured out, no, it's this longer or this shorter. And that's how do we show that aspect to people who might not be aware of science is always changing, or we're always learning, whether the change be now or in 10 years.
I think someone asked Dr. Fauci the same question that he got back from on NPR yesterday. So we're still working on it, and I think what this has taught me is that we need to be better communicators as doctors. Like I've always told my dad, I want to go back and get my MBA in marketing. Because imagine if doctors were as such good marketers as Apple. Apple gets us to buy a new phone every year that's exactly the same. And $15. Like, and make it my pants off. Boom. Oh, there we go. Yeah, I hadn't even get my patients to take their Advil. Like, it's right, there's something to be learned. And whether I have to color it. And sometimes I tell my patients, you know what? Advil didn't work for you, right? And you tried the extra strength one? That one's going to work. And, sometimes I have to dress it up. And I do it all the time. But it's the way we do it. And I have fun with it. It's skill.
Yeah, I think the other part is that doctors have to be humble. They have to have humility. And one of the things that I've learned in my trajectory in medicine is that you have a selection of individuals that have been told they're wrong. This whole journey is considered the cream of the crops. Yeah. And yes, physicians have to accept that the majority, when you go into medicine, they'll tell you it's not a science, it's an art, right? And there's a lot of things that we don't know, and we need to be able to anchor on the idea that we can only speak from what we do know. So you have to build that trust, but at the same time, when we're wrong, we have to say we're wrong. Because that's how you build trust and transparency and authenticity. And that's how all relationships, regardless of whatever that is how you build it, right? I learned that not in medical school. I learned that through my weekend work. Because I had to go to another physician and be like, do you want to strike? What will make you fucking move the needle for you? And that meant building a relationship. And it translated so much into my day-to-day physician care. But with that, I do want to be able to introduce Melissa Gonzalez, Kaya, the son. She is a third-year medical student right here in Los Angeles at USC. She has also been one of these people that I consider visionary. When everything looked like it was impossible, she said, we'll figure out a way. So can you tell us your medical journey and why does digital health matter to you? Why does it matter? Gracias.
Yeah, thank you so much. And I'm so sorry. There is some difficulty going on, but I'm glad to be here now. My name is Melissa. Thanks for the introduction. I'm from Southern California. Both of my parents are Mexican immigrants, and they kind of shared their own stories about the lack of healthcare in their own hometowns. And so as a 5-year-old, I thought, oh, I could be a doctor to help. And so here I am, over 20 years later, and in medical school, my 3rd year at Keck. And it wasn't an easy journey to get here. And I'm not sure how many pre-meds are out there listening, but it's totally worth the journey. And there's always a way to get, to where you want to be. So please continue, because our people need us. And so I'm very, grateful to be where I am today. My interest in digital health is fairly new. It really was something that grew out of a research project I started with the Department of Family Medicine in conjunction with the USC School of Early Childhood Education and their Head Start program. And through a research project at my school, I was able to do focus groups and create a workshop curriculum that was focusing on health topics. But all of this we wouldn't have been able to do if Zoom or virtual platforms were not available to us at the time. Given it was like 2021, COVID was still very much, and it still is, but it was a lot, it was a bigger problem, I think, then. So it really allowed us to communicate with the community and hear from them exactly what they wanted to see in these workshops and what they most needed, education on and help with. And I think it's been really a wonderful opportunity for us to use digital platforms to connect with the community and for their own health education and just for connection as well.
Thank you so much. So I'm going to get you up to speed where we're at. I want to know your aha moment. I want to know what you said. This is something different. This is a new avenue. This is something that no one else is in, and I'm going to kind of dive right in. What was that moment? So explain us a little bit about that.
Yeah. I was trying to think if I had an aha moment. I think this really was just a progression of a lot of things. And I finally just kind of looking back on it and talking to Dr. Fernandez, she kind of just opened up my mind to oh, wait, I have been doing digital health, related things. And I didn't really pinpoint it until, very recently. And because of that, I think I'm able to have this new perspective on digital health and equity. And I think moving forward, given especially the very the lack of education that I think that med students right now get on digital health, it is something that I think will definitely be something I look for in a future residency program and in a career that I think values that aspect of medicine now. So I'd say my aha moment was more of a progression of things, but I'm happy that I finally kind of come to see all these things that I've been doing in these last few years have really shown that I do have this interest, and I think will continue as I move forward in my career.
Beautiful. So the next question that I have for y'all, I think there it is. The way I framed this question, on face value, is positive. But the reverse is, I think, what most people experience, especially when you're taking a road less traveled. Where have you found the most support? And where do you see further support coming from?
Yeah. So most support I've found really has been, and on my journey to medical school, there a lot of the support was, my fellow first gen students and students of color at my, predominantly white institution that I went to for undergrad, where it was hard to find that support. So I really relied on the upperclassmen at my school to kind of guide me, especially. My parents have no idea like what the college and medical school application process is like, as I'm sure many can relate to. And so, and since then, I think I've really seen a lot of support through social media. Like, for example, I wouldn't be here if it wasn't for meeting Dr. Fernandez on Instagram. And so I think it's like all these connections are just, these virtual, these apps and these virtual platforms really give us the ability to connect and network and feel supported by people who have similar interests and who are also interested in mentorship, which is something I'm really passionate about.
Thank you. That was a beautiful answer. Do you have anything yet?
Yeah, I'll really add the same thing. I think mentorship and having organizations like this, right? Like Maya was connected to Danielle and his organization to one of my mentors, Dr. Alvarez at Harbor. And being able to say, hey, look, this is somebody else. And, jumping on the bandwagon to be like, let's plan a conference. How do you do that? Oh, I don't know. Let's figure it out. But being uncomfortable in those spaces and having mentorship is important.
The only I would add is when I first met Dr. Fernandez, I was like, whatever she needs to be successful, that's what we have to do. And the reason why I say that is because a lot of the discussions earlier today were about you have to present something to decision makers. We can be those decision makers. If we are in those decision making spaces, we have to identify novel and new ideas. That's where progress comes from. And that's bold leadership. All right. So we're running out of time. Especially because I want more Q&A. But I do want to know what the future generation of doctors look like to you. Because I think the medical industry has created a path for physicians of what they want it to look like. But I want to know for folks that said, I don't want to be the traditional physician. What does a future generation of physicians look like to you? We'll start with Jhaimy and no limbo's.
Well, I think doctors have purposely been kept with like blinders on, because if you take those off, man, we would be so angry. You let the cat in the hat, right? I think the future physicians needs to be multi-talented. I'm starting the first digital health equity concentration in family medicine here at Harvard. I need this to be nationwide. I need people like Melissa who have an interest in digital health to be able to say, I want to train and demand that from the medical education, because that's our job, that's our livelihood. I even told my program director, by not being able to do video visits here during residency, how am I going to be able to apply to a startup right here? Really kind of be off of my feet. I've never done it before. So I've actually proactively, one of the only residents in my resident program that has video visits integrated into my schedule, because I go out and make them, right? But this should be something that other residents can do, especially at county when accessibility is the main thing that we do.
Melissa?
Yeah, and I totally agree. I'm not sure. I think it'll definitely be, it's already a big part of our lives, and it's only continue to be a bigger part of our lives is digital health and digital platforms. And for example, I'm currently on my family medicine rotation at a Kaiser clinic, and this is the first time I've been able to see a health system, integrate video and telephone visits so, seamlessly into their schedules. And so I think just seeing that, for example, it just shows me like what is now and what can become in the future in these years as we become better at adapting and implementing these things. And just like Dr. Fernandez says, I think it really is going to be hopefully a part of the curriculum in residency programs, and especially med schools, because it's definitely lacking. And I think if we don't get the training now, just like Dr. Fernandez says, we're going to be, we will be better physicians having this training and able to adapt and take care of patients and come to them where they are, wherever they may be. So.
Also, I just reminded me the first time I picked up the phone and I called the patient. I was like, "Hey, this is your doctor. This is our visit." You realize that I had no prior experience, and I was like, "What do I do for?" I don't know. And now it's like the majority of what we do, and that was only 2 years ago, right? So this is an evolving space. I do want to open the floor and be intentional to have time for questions. Please, raise your hands. People in the back, I see y'all. And again, shout about, and I'll let the people on the internet, here as well. So, open floor for questions at this one. I saw a hand right here.
So I want to know what we're planning at Hackathon. I did work with a startup weekend. Google, they have really, really great hackathons. I think free design thinking to the Latino community would be great because we're always like wanting to join ideas for the community. Like, let's do it. Okay, awesome.
And that's why we meet. Any other questions? Oh, we have questions, please.
So for the practitioners who saw patients both in real settings and in digital settings, what has been the most remarkable difference that you may have observed?
No, I'll let Melissa, do you have anything to add? And then we'll go down the list. I definitely have a comment on that.
Yeah, I mean, I'm still a med student, so I'm not sure. I feel kind of like, I'm not fully a practicing physician yet, but I think as a future physician, just seeing how, my mentors and my attendings have been implementing their video visits, it is a way that I've seen them able to see patients who aren't able to drive in and don't have help from family to take them to their appointments. And it's what's really allowing them to keep track of, how they're doing on their very chronic conditions like diabetes and hypertension. And I think just being able to check in more frequently is something that's been really great about, telephone and video visits. So that's just one thing that I can think of off the top of my head.
I love seeing where my patients live. I had a 13-year-old mental health check, and she showed me around her bedroom. And we realized that she eats, does her homework, and sleeps on her bed. And it was scattered with chips and all these things. And I was like, I wonder why you're not sleeping well. And it was less of me having to convince her, more wonder where is it? I've seen and chilled. So that was the most powerful occasion that I've had.
Yeah, I mean, you see the good or the bad. I would say in the beginning, I would be talking to someone because we had no access to video, so you couldn't see. You could only hear, and then you would hear that they're at work, which allows them to work. And I was like, if they don't have to necessarily take a day off, regardless of their of their immigration status, their current living situations, we want to make it accessible, and that was great. The other side was when I was like, I can't really tell what's going on. And we have to somehow be able to bridge that a little bit better because I ended up being all right, well, I need to see you anyways, so let's schedule you in. And some of that felt like, I could have just done that all at once. So it's a balance. And I think with being able to implement further technology, being able to make sure that, like we said, the utilities, if people have broadbands, because I run out of data. Yeah, and then, I'm asking folks to, use their data. These are topics that we need to be able to address as we move in this direction, but I know that this is the direction that we're going. So there's positives and benefits, and you are also able to talk to more people in the family. So you talk to the wife, you talk to the daughter, and you talk to the person that doesn't believe what the doctor's saying, and you're just and you have to do this in less than 15 minutes.
It should really be a game show.
Any other must-know? Oh, we have one.
Carol, go ahead. Everyone, I'm just wondering if you could share some best practices that you've incorporated in your very short amount of time with your patient, because Latinx folks, we like that people-to-people connection, right? So maybe just some general best practices that you've been able to incorporate to really give them that warm touch.
and some pay comments on how to grade. One thing that I've done this year is intra-year was only seeing 5 patients a day, and now I'm seeing 7, and I know practicing with the GIC double that. But what really helped me is getting away from the computer and bringing my laptop. So my laptop is on my lap. So my eyesight is here, and I can type like this.
Yeah.
So, and I make it a purpose to look at people's eyes, at least for the first 2 minutes that I'm there. And I feel like, because people get really intimidated when you look straight in their eyes, it makes me a little slower, so they're a little bit more concentrated. But for me, that's what I've been trying out, and I feel like it's been helping.
Yeah, I haven't seen any patients personally yet on these video visits. I just kind of see my attendings do it, but I think they really do a good job of checking in with how the family's doing, and hey, I remember your daughter was going to college, how are they doing? And so I think that's something you already can do in person, but the fact that you can still continue to do this virtually and on video visits, I think also just shows them that you're still interested and you're still paying attention despite being disconnected by location and being online.
I'll just add really quick. I think the only thing I would say to that question, best practices, is the initial visit I prefer to be face-to-face. Mostly because I want to be able to even just have that personal connection with the individual. Then after that, I schedule folks on phone visits, whatever is easier for that individual. With that being said, the other aspect of what was talked here today, having that influence outside the clinic, is also pivotal. There's been many times, because in my current position, they've asked me to be on certain TV shows or anything like that, where people recognize me. And my patients are like, I saw you. And there's a sense of pride, and those are the patients that I can't never stop seeing because they always sign up. So the moral of that story is that there is a sense, if you're able to really go to the community, be a part of the community that you're serving, be at organizations that you're for, because they need to see that you're invested into where they live as much as you're invested into them in that clinical setting. Then you bring them up and you create that one-on-one relationship. And then after that, that trust is built, because the last thing you want to do is them misinforming you.
It's this line. It is also correct. With higher, I believe these organizations. We know that the history of healthcare and health education was rooted in white supremacy. And it has really been the younger med students, next generation, that have done a lot of advocacy work to start to challenge some of that. So when we look at EGRF, right, and what's happening, that having that of Mount Sinai, med students came together, organized, made that happen. When we look at the history of digital health, kind of the same thing, was not created, right, intentionally to center, to be equitable, have some of the same premises. I'm curious to hear from the two of you, or the three of you, what do you see as the spaces and the places where y'all are going to hold the digital health community accountable and see some of the things that we know are still very much rooted in white supremacy and really oppressiveness. But what do y'all see, or what would you want to see if you had the magic wand? Big question too with it.
Yeah, that's a big question. Honestly, I think just more technical support. I think without doing my video visits and I have some audio trouble, I'll ask, and I'll troubleshoot as much as I can, and then I'll ask my attendants, my attendees, and they'll be like, oh, well, just do something else instead. It would be so much better to have, and the thing is, we're in a clinic that's session outside of the hospital, and they do have somebody that can go and help you when that happens, right? So having the institutions that can support that technical aspect, because though we're saying we're digital natives, this is different. And we can even, as physicians, get onto the platform and navigate ourselves. There's no way we can ask our patients to do so. So I would love more support in learning how to troubleshoot, learning how to do these things so that I can teach my patients how to do it and be more empowered. I see Jeffrey smiling there.
Yeah, I think mainly is just the first thing I think about is just access. And I guess that's kind of what we're talking about here at this conference, is just making sure everybody's able to just be able to join, these platforms wherever they may be, whether it's via phone or on their computers. But I think that's what's going to take, is that everybody having access so that this can be, available to everybody who needs it, no matter who they may be, where they're from, their economic status. And so I think that's going to be the most important thing.
So there's this article that talks about decolonizing the decolonizing movement, which I think is what this question is about. And the reason why you all should look it up. It's a great article. And it's really saying if we keep using the same tools over and over, we're going to get the same results. And at the root of all this, I truly believe white supremacy is taught. It is propagated. So in order to be able to remove it, we have to get at the root, which is education. So that means everyone here should read Medical Apartheid, right? Like that, everyone should be able to read that book, understand that legacy, and how the medicine that we're practicing today is rooted on the bodies of Black and brown folks, oppressed individuals. So until we're able to wrap our minds around that, address it, and if we really think about how to remove those layers, then we're not really going to create a different system. And we see it with the racism in AI, right? That's that conversation as well. So I think it's important that we have folks excel in this, that understand that rooted racism, in order to be able to get to the point of decision making, to be able to say stop, just like we did with the EGFR, right? Just the same way we finally were able to get enough of influence to say we will no longer accept these racist things that were taught to us, and we're not going to use them. But that takes intentionality. That doesn't just happen. And I think being here with SaludConTech, being able to uplift these voices, we are creating that next narrative, and then we're already talking about it. And like we're literally looking at a camera and saying, the white supremacy was that is a game changer in itself. And I think like once we start looking, and from my union side of the work, we believe in social justice and bargaining for the common good. And that level of unity is how all of society is going to take that next step forward. But it's not an easy one. And I don't think anyone's actually done it successfully. I think that's it.